Hey guys, welcome back for another week. Remember, this month I have been incorporating soap notes on the theme of what we've been covering for the week and just utilizing one of the practice questions to gear your mind on how to write a soap note with particular diagnoses, right? So, this week we're covering hypertension, and here's one of the scenarios from one of our questions, and then we'll formulate it into a soap note, okay? So the question states, Miss Shepherd is a 47-year-old African American female that presents to the office today for follow up. She has a past medical history of diabetes and asthma. Her blood pressure today is 142 over 92. At the previous visit, we discussed initiating lifestyle modifications, and then it has the question to it, okay? But remembering what it is. So SOAP is an acronym to help you to break down your documentation when we're charting on our patients, right? So the S in SOAP stands for subjective, the O stands for objective, the A is for assessment, and the P is for plan. So S being subjective is what are you hearing the patient state? What are they stating? What is the chief complaint, right? So if they're coming in, are they saying something is hurting? Are they saying that they're having dizziness? What are they coming to you and stating that is wrong? So here, and I'll get into that in a minute. O being the objective, what have you observed? So, what do you see? What are you seeing with your patient? Also, vital signs go here, right? So, anything that you have evaluated and put together from your visual assessment and exam goes in the O section. A for assessment, I tell you, it's basically a summary of everything that you have assessed and analyzed and what have you come to at this point and what differential diagnosis have you come to. Put all that here and then plan. What is your plan, Stan? Like, what's the plan? What's your treatment, right? So let's get into each one of these acronyms based upon the scenario I just read. So for subjective, so here, there's no complaints. The female patient didn't have any complaints. So uh, I like to put that there. So I typically will say like patient denies any complaints at this time. And I usually ask specific things. So, patient is denying chest pain, shortness of breath, dizziness, any syncope, all of these things. Um, uh, I put here just a note that this is a follow up for blood pressure. So, that chief complaint, they really don't have any complaints today. So, letting it be known that this is a follow up exam for blood pressure. Past medical history, you put that here. So, the patient states they have a past medical history of diabetes and asthma, and then implemented lifestyle modifications such as the DASH diet and exercising. The patient said that they're doing the lifestyle modifications that we discussed in the previous visit. So for me, what I would hear, I like to kind of jot those down into notes, but when I kind of formulate it all together, that's when I do my full HPI. And so it would be kind of like how the question is written. So I would have put Miss Shepherd is a 47-year-old African American female returning today for follow up of blood pressure management. She denies any complaints today. She denies any chest pain, shortness of breath, any dizziness, any syncope, any changes in diet, uh, and appetite. Patient states she has a past medical history of diabetes and asthma. Patient has implemented lifestyle modification as discussed at previous visits. She is utilizing the DASH diet and exercising 5 days a week for 30 minutes each of those times. So that would be my subjective blurb based off of those little key points that the patient stated, right? All right, next. The O, the objective. What did I observe? What did I see? So the patient is well dressed, um, the vital signs here, because again, it's a follow up. So, really, this practice question didn't have too many details on the patient, but the blood pressure today is 142 over 92. Of course, include all of your vital signs here in this area as well. But here, I'm just putting what the question gave us, okay? And then assessment. Again, the assessment is a summary of what you have assessed and tied together, what your analysis is of all of those moving parts and pieces and the differentials that you have come up with. So here, I like to kind of put it into subgroups. So hypertension, will be the diagnosis. Lifestyle modification has been implemented since the previous visit. Next BP today is 142/92. And then patient denies any other complaints. You're putting all of this together so you can group it. So it seems repetitive, but whenever you click and you're looking through things, you should be able to tie the story together. So if someone is doing a consult and looking at it, it's as if they were in the room. And then the plan. So what's the plan? What's your treatment option? So here, and if you remember the question, based off this patient, we want to do an ACE or ARB. They are diabetic. Lisinopril was an option. So here for my plan, I put initiate lisinopril 10 milligrams PO daily. Patient to continue lifestyle modifications of the DASH diet and exercise. Patient to follow up in 1 month so that we can assess the blood pressure. Patient to keep a blood pressure log over those next 4 weeks. And the goal range is to be less than 130/90. So here, when I do a plan, and I wanted to kind of really give you something based off of what we had. So for this patient, again, we do an ACE or ARB. I did lisinopril because that's what was one of the answer choices on the question, the practice question from yesterday. So lisinopril. Now, typically when you initiate in this, you want to start with that. You want to start lower, right? And see how the patient responds. You can adjust as needed. So 10 milligrams, you would start with that 5 milligrams if they're already on a diuretic, but the patient's not on anything right now. So for the practice question purposes in this scenario, I did it like this. So lisinopril, 10 milligrams PO daily, right? That suffices for what we have going on. Again, because why? They have a history of diabetes. We want to do an ACE or ARB to protect the patient's kidney function as well as treating the blood pressure. You still want them to continue with those lifestyle modifications of the DASH diet, the exercise. Once you get started on that, you don't tell them to quit that so they can continue that. So you put that in there. So again, as you go back and look the next time, you know what you have done. So you'll know whether to add, what adjustments you need to make, what you have tried. Have them follow up in 1 month because you need to assess and see how this medication is working for the patient. But also, you don't want them to just come back and you assess on that day. Also, it's very beneficial to give them a list, a BP log, so that they can document and chart down how their blood pressure is through that 4 week span until they return for their follow-up. So that also gives you an assessment of how it's really been responding and how their blood pressure has been doing each day over that 4 week span versus just you checking again on that day, because sometimes people have white coat syndrome. They may have missed a medication. Various things can happen for that one day. So this gives you a better assessment of the patient's blood pressure reading in response to therapy that you have initiated. And then I also like to put the goal that we're trying to reach, right? And so that you can still kind of see that. So remembering, based off of ACC and AHA guidelines, we are, for people who have comorbidities, our goal is that we don't want their blood pressure to exceed 130/90, right? So I put that blurb in there too, because that's how we function. But I'm wanting y'all to see that the stuff that you're preparing to test for it still flows in the format of how you treat in the breakdown so that you can see it and tie it all together. And I want you, even in school as you're studying, to see the picture this way. And sometimes you don't know what you don't know. So if you don't even understand how to apply it, when you're even in clinicals and things like that, you can't even get your mind to this state. So I'm trying to put this in early for you guys so that you'll be able to identify and start to train your mind to think in this fashion so that it can help you not only on boards, but in practice as well, right? And then this is just the full picture altogether. So once you put everything together, it creates a note, and typically with the EHR systems, it'll have it and formulate it all together for you. But it gives you that full rundown so that you can see it all in one. And then you can choose to go to specific areas to get exactly what you need at that moment. But you guys, I hope you found this helpful. We'll continue this for this month each Thursday, whatever topic we're covering for the week to go over it. We have a couple more weeks of this, so you'll have a few more to kind of gauge and assess and get your mind geared around soap as well as how you apply it to boards. But as always, thank you guys for watching. Please be sure to like, comment, and subscribe and share to whomever you may think may find this helpful. But be sure to meet us back here next week. Bye, y'all.